Hello, this is Diagnosis Bona Karatse and it's me, Dinara. Today we are talking about hemorrhagic rashes, so let's get started. Started. There are three types of hemorrhagic rashes. It's a petechiae, less than 5 millimeters. More than 5 millimeters will be purpura, and much bigger, like 2, 3, or 5 centimeters, it will be hematoma, ecchymoses, or just bruise. So let's start with connection in purpura. Connection in purpura, it's a vasculitis of small vessels, and there is a typical rash for this, which is from this name, it's a purpura. It will be palpable rash, and we usually can find it on the legs, arms, and buttocks. For criteria, we also have to have some other conditions like abdominal pain, renal problems, also joint pain, or we can find immunoglobulin A deposits in skin or kidneys. So, what about symptoms? As I said already, so it's a joint pain, abdominal pain, which can lead to very bad complications like intussusception in kids, and also it could be renal problems with hematuria, proteinuria, so with um, protein in the urine or blood in the urine. And also it can lead to very bad conditions like chronic or acute renal failure. So if we're talking about investigations, so we do blood test and we can find leukocytosis, thrombocytosis, and also raised ECR and CRP. And also we have to do ultrasound to exclude any condition with abdominal pain. What we can do for management? Usually it's a self-limiting condition, so more than 90% for these kids. So it's this condition is very common for kids, and then adults will get nothing. So it's just appropriate hydration, just being in bed, have a rest. But for kids that have abdominal pain, renal problems, we can give steroids. So the next condition is immune thrombocytopenia, and this condition is from this name, it's an autoimmune condition. So there is antibodies to antigens or protein on the surface of platelets. And in this condition, this person will have excessive bleeding, like nose bleeding, gum bleeding. So, for example, and also they have a different rash. So in this case, they will have petechiae. In analysis, you can find that they have thrombocytopenia in this case already, and it's a diagnosis of exclusion. So for these conditions, you need to do a lot of analysis to be sure that this person doesn't have other conditions with petechiae or thrombocytopenia. If we're talking about management, in this condition, we can give intravenous immunoglobulin. So also anti-D therapy can be used, steroids, and in some severe cases, also they can do splenectomy. Splenectomy is very effective therapy because we know that this antibodies is producing in spleen, so we're making reduction of these antibodies, and also the storage of platelets actually spleen. So when we um, just cut it out, so all these platelets now in the bloodstream. But it's a huge, very important immune organ in our body. That's why it's just the last resort. So now let's talk about hemophilia. There are four types, A, B, C, D. So let's talk about just two of them. It's a factor VIII and factor IX deficiency. It's a hemophilia A and B. In these cases, it will be more nostril bleeding, more gum bleeding. It's easy breathing, and moreover, all this blood can go to the muscles, can go to the joints. And for this condition, what we can do for investigations, we very good investigation will be a PTT, so activated prothrombin time. And even though that there is a hemostasis, first and secondary hemostasis. First, it's about platelets, and secondary about these factors. And we have also in the secondary hemostasis intrinsic or internal pathway and external pathway. So now we are talking about if it's a eighth or ninth factor. So we are talking about internal way, and for this way is a very good test is the APTT. And if we're talking about external pathway with the factor 7, so we do PT, so prothrombin time, but in this case it will be normal. So for treatment, we will give these factors like for if you don't have factor 8, we give this. If you don't have factor 9, we give factor 9. So sometimes they can get it once a year or more. It depends on the level of their bleeding. In emergency situation, we can give fresh frozen plasma. And also there is the cryoprecipitate or desmopressin also as a treatment. And the last one, abscesses, so it's a cancer of blood, and it's very important that know about it because it also can be petechial rash, and it's absolutely the same with the immune thrombocytopenia, could be, but it's a very dangerous condition. How we can differentiate it? So at first, we have to palpate or to find this lymph nodes. Yeah, it could be a big lymph nodes, and they are different from lymph nodes that we can find in inflammation because when it's an inflammation, the lymph nodes will be also bigger, but they are rubbery and they are painful. But in cancer cases, yeah, they don't have any pain when you touch it, and also they are very hard like stones. What about other symptoms? So other symptoms can be tiredness, weight loss, night sweats. It also could be bone pain. And we know that it also will be symptoms of anemia because, for example, if we're talking about kids, it will be usually acute lymphoblastic leukemia, and they have a lot of blasts. At first, we can find them in the blood, as is blood, but we can't differentiate them in blood, so we usually also take them from bone marrow. And in bone marrow, if it's a more than 20% of this blast, it means that it's most likely cancer. So if we're talking about other symptoms for leukemia, it will be bone pain, it will be tiredness, night sweats, weight loss. For investigations, we will check blood for blood, bone marrow. We also check other organs with a CT scan, MRI scan, PET scan. We'll do ultrasound. And for treatment, we do chemotherapy, radiotherapy, and also transplant stem cells. It could be from relatives or from this person when he has a remission. And again, all this condition has a different types of hemorrhagic rashes, or sometimes some of them very similar, sometimes quite different. But anyway, there are mild conditions, not very serious, self-limiting conditions, yeah. But also there is very dangerous, life-threatening conditions. If we're talking about differential diagnosis, it also could be a sign of meningitis, for example, for purpura, yeah. Or, for example, it could be disseminated intravascular clotting syndrome. And these conditions are very, very dangerous. That's why if you have any rash, it's better to go to a doctor. And because without proper investigation, like physical examination, laboratory investigations, it's very, very difficult to put the right diagnosis. So this is the end of this video. Thank you very much for listening to me, for watching to me, and see you next time.